This is Lloyd Bluen, and this is my video presentation for Psychopathology for Counseling 5113. This video presentation is part of week 1 assignment called Splitting Schizo-Hairs. So let's jump right into it. So I want to first start off with discussing the key factors that define psychotic disorders. Psychotic disorders are, according to McGill's medical guide, are a group of mental illnesses that share psychosis as one of their clinical features. They are a person that has these psychosis. They share gross impairment. They may have gross impairment, a detachment or impairment of one's sense of reality. They may have delusions, hallucinations, thought disorder, and bizarre behavior. These psychotic symptoms may be the primary component of an illness, or they could be a secondary to a mental or physical conditions. These episodes of psychosis can be brief or chronic in duration, lasting from a few days to many years, and can be mild, moderate, or severe. The type of symptoms that a person would have with these conditions can be delusions. Now, delusions are false beliefs that are associated with misinterpretations of perceptions or experiences. There's different types. Most common are grandiose delusions or persecutory delusions. Persecutory delusions are which a person believes that they're being spied on or plotted against. Grandiose delusions are a person, they believe that they have special abilities or they're rare, or they're like a deity. They are a really famous person. Then there's hallucinations as a symptom. That's when they have false perceptions, the absence of real stimulus. Hallucinations may involve the 5 senses, but most hallucinations are auditory, meaning a person hearing voices. They may hear somebody speaking to them. They may hear a lot of noise, and you may even, this person may even be seen with banging their head against the wall to try to quiet the noises. And some, according to one of the videos for class, some have even welcomed the voices because the voices make them feel not as alone. But they also may have the physical things, the hallucinations that they can feel or see. They may have feelings of tingling, electrical crawling, or burning sensations. And then they may have hallucination where they smell something. But like I said before, the most common hallucination would be the auditory hallucination, what a person hears. Now, from a diagnostic perspective, the difference between the main 3 forms of schizophrenia, whether there's schizophrenia, then there's schizoaffective, then there's schizophrenia form. So let's talk about those 3 briefly. Schizoaffective disorder deals with the ABCs of the mind, which is the effect or the emotions of a person. Then you have the B, which is the behavior, what a person may do. Then you have the C, which would be the cognitive, how a person's mind is affected. It contains features of mood disturbance with manic or depressive episodes, as well as the symptoms of schizophrenia. Now, in order to diagnose somebody as schizoaffective rather than schizophrenia or a mood disorder, both schizophrenia and the mood disorder symptoms must be present majority of the time with a person that has schizoaffective disorder. The next one is schizophrenia form, which is more brief. It lasts fewer than 6 months. It's a mental condition that causes symptoms of psychosis like hallucinations, delusions, and organized speech. But like I said, it's a shorter duration. The other thing that I want to briefly talk about is why is it important to have specifiers and modifiers? The main reason is it's important to have specifiers and modifiers in diagnosis because it allows mental health professionals and healthcare professionals to offer proper care. You got to know how to treat this person, whether it's schizoaffective, or whether it's schizophrenia form, or whether it's schizophrenia, or even bipolar, or any other mood disorder, neurological disorder has to be able to pinpoint how to treat this person. So those specifiers and modifiers will help determine how we're going to treat this, what type of medication, the duration of the medication. It also the frequency of symptoms, have to know what type of how long these symptoms are lasting. So those modifiers and those specifiers will help mental health professional determine that. And so that is it. And I thank you for listening.